So I'll just start with an introduction. So, Dr. Pam McDermott. So I've been a physician here in Muskoka since the 80s, and most of my practice has been focusing on mental health and psychiatry. And I had been attached to the palliative care team as well, and I do workshops and events with the medical students and with hospice. And I have a bunch of other jobs that I do, and I'm supposed to be retired, but not very. All right, so before we do anything else, I've got a couple of questions for the audience. So who here has had any kind of a condition, a disease, a disorder, aging, that has changed your life in any way at all? Just put your hand up. It looks like there's some people who've never had a thing. Well, that is awesome.
I just can't remember.
So that's changed your wife's life. He says he can't remember. Okay, the second question is, given that you've had things the matter, or even minor things like just getting older, who here has had a completely, totally seamless, uneventful exchange with the medical system where you came away and you knew everything and you knew what to do and you knew what was the matter and you felt totally in control? Is there anybody? Oh, actually, excellent. I'm going to ask you about that later.
I don't remember.
Yeah. We have a lot of memory here, obviously. Well, I guess you could leave now because you're not going to remember the talk, but it is recorded, though, so you can review it. Okay, so this is not meant to be a criticism of the medical system at all. I've worked in a few countries, including the States, other than Canada, and we're really lucky here. But medicine is very complex now. So I was a nurse before I went to medical school. And so I was in the 60s. And at that point, life expectancy was in the 70s. Women always lived a bit longer than men did. And now it's in the 80s. So we've added a whole decade onto life. And this is not necessarily a decade of health span. It's a decade of lifespan, but not necessarily health span. So that's one issue, is we've got a lot of much older people than we had 50 years ago. So that's one complexity. And the other is that medicine has become so complex in terms of what is available and what the options are. So again, when I was a young physician, we had ultrasound and x-ray and some nuclear medicine, fairly basic. And you look at now, what do we have? Right here in Huntsville, we've got regular x-ray, we've got sophisticated ultrasound, we've got CAT scan, we've got CAT scan angiography, we've got MRIs. We have so many more blood tests, things that we hadn't even heard of when I was in medical school. So that's another complexity. And in terms of what treatments are available, so just as an example, COPD, which is a respiratory condition, when I was a student, when I was a younger doctor, we had maybe 2 or 3 drugs, and now there's something like 20 drugs just for that condition. And cancer treatment, there was just a handful of drugs available way back when, and some very kind of overarching radiation, and now there's something like 200 cancer drugs and treatments. And then we've added into the span of diseases a much longer span of life. So why does this matter? This matters because it means that there's so many more decisions to make. It used to be basically you went to the doctor and they would give you what the treatments were, and you kind of did it or you didn't do it. But now there's so many options that your input is going to be really important, and that's what we're trying to get at, is how do you get the information that you need. So just as a reference about what I was saying about the complexity of medicine now, is that this is from the longitudinal study on aging, Canadian study, that if you're in your 60s, you might have 2 or 3 chronic conditions. Not necessarily serious. It might be, high blood pressure, or it might be, arthritis, or type 2 diabetes. But still, it's something that you have that's going to be an ongoing condition. Once you get to your 70s, it's very common for people to have 3 or 4 conditions. And by the time you're in your 80s, this trends up to about 4 or 5 or more. So when we look at the population that is now having to interact with the medical system, you can see that it is going to be very complicated as to how to help people. And so on the physician side of things, it's complex to know how to help people, obviously. And on the patient or caregiver side, it's on, of all of this broad swath of options, what it is that I do, what should I do? And more you're going to find that your opinion is being required or sought out. So on the title that of my opening slide is, I wish I'd known this sooner. So what is it that people wish that they'd known sooner? When we talk to people who have gone through a lot, they often say, I wish I'd known various things sooner. So they wish they'd known they got what their diagnosis was more clearly. They wish they had a better idea of the diagnostic options and because we don't necessarily want to do all the diagnostic options. Do not get total body MRI. I hear ads about that. You do not want to have that because you're going to find all sorts of what we call incidentalomas that you're going to have to figure out what to do with. So that would be an example of people would wish they had known that would not be a good route for them to go. People wish that they had known what the treatment options were, what were the upside and the downsides of those options, and what would happen if they don't do them. We aren't just going to go along and just do all the things that are necessarily offered. It's the physician's responsibility to present people with the standard of care as according to the guidelines. But it's also on your side to decide, is that going to be right for me? It's not like it's bad advice, but it may not suit you depending on your stage of life, what else is going on with you. So some foundational things that's important is you are allowed and encouraged to have an opinion about what happens to you on the patient side of things, as well as an opinion if you're the caregiver of somebody. You are allowed to get all the information that you need to make a good decision. You have the right to ask as many questions as you need to have answered in order to make an informed decision that fits your values and your goals and your preferences. And you have the right to be involved in your own care. And doctors mostly, we do want people to know what's going on. It's a lot of responsibility to make decisions for other people when you don't really know all the inside story of their lives. And so it is usually really welcomed when patients want to know what's going on with them and get more information. So I forgot to say at the beginning, Norma Connolly, who's a retired nurse who was the lead of the palliative care team, she was going to be helping me with this tonight, but she's at home with the flu. So that's why it says we here. So what I hope that happens tonight is that you get an idea of what some of your own preferences and values and your style is, and how do you communicate these to the people that are providing your health care to you, and that in the end, you would have care that's tailored to you specifically. So this is an introduction basically to a workshop program that Norma and I are running, and we've run a few of these now, and I'm going to tell you more about that. So you're going to get some ideas about that tonight to take away. But if you're interested in doing a deeper dive into any of these areas and get more support, there's a sign-up sheet at the back there. And if you just sign your name and how I would reach you by cell phone or email, then I can follow up with you and get you signed up for a workshop. There's no charge for it, and there is materials for it, which I'll show you. And even if that was a barrier, we would cover that. So what the basic emphasis of the talk tonight, as well as the program that we're running, is that being in the know is way better than being in the dark. And that might just seem obvious, but in fact, many, many people go through an illness journey and they are in the dark often. They do not necessarily know what's going on with them or what's going to happen. And there's a lot of research about what outcomes to expect if people are more in the know. I'll just go ahead a bit here. So these two books are the result of a couple of researchers who've done a lot of work on people with serious illnesses or end-of-life conditions or palliative care. And what they've discovered in their research is that people who know what's going on with them, who have made choices that fit them and feel like they have more of a sense of control, do way better in all areas. They do better emotionally, they do better physically, and often the outcome of their condition is better. I mean, it makes sense. I mean, if you get a diagnosis of, let's say, diabetes, if you know a lot about what you have to do for your diet and exercise to manage your diabetes, the outcome is going to be better. So it just sort of makes sense. And if you multiply that by if you've got a more serious condition, that just is amplified. And as it gets more complex, it's harder to know all the bits and pieces. So I'll just go ahead and show you. So these are the two doctors that developed this program as a result of their research. There's lots of ways to get this information, but this is one way to do it. And so Dr. Sierra, the fellow there on your left, he's a palliative care researcher, and Dr. Winemaker is a palliative care doctor. They have a terrific podcast, if you like listening to podcasts, called The Waiting Room Revolution, and they interview all sorts of people. It's for the lay public, so it's easy to understand, and they give a lot of information, and they have set up this particular program, and it's actually being delivered all over the world, because what they discovered was that they started out by trying to educate doctors. That didn't work so well. So they thought, we better educate the public. And so that is what started this whole process. And from the book that they wrote, which is Hope for the Best and Plan for the Rest, which is an excellent book, by the way, called 7 Keys for Navigating a Life-Changing Diagnosis. It doesn't have to be a life-ending diagnosis. Almost anything that we would have happen to us changes our life in some way. And the workbook is to allow you to write things down. There's many questions in there or reflections to allow you to think about what your particular style and values and preferences are. Okay, so the 7 keys. So that's what this program is called. And they, as a result of their research, came up with, they kind of collated information into these particular themes and came up with these 7 keys. And we don't have time to go through every one of them thoroughly, but we're going to highlight a couple, and I'll give you an overview of each of them. So, okay, so the first key is walk 2 roads. So what are the 2 roads? So one road is hope, and one road is being realistic. We've tended to think that if we're realistic and we hear the news, which maybe isn't so great, that we can't have hope. Or that if we have hope, we can't really look at the other side of things. But in fact, we can do both together. And it's really important to do both together. So just to give you an example about hope as something that evolves. So a young person, I mean, they probably don't even think about it, but if they did, they just hope that they get through their whole life and never have anything bad happen to them, and that they, maybe die at 90 in their sleep or something like that. But of course, that's not very realistic. So hope needs to then shift to, okay, now maybe I have some kind of a condition. Maybe it's just I've got arthritis, or maybe I've got high blood pressure. And so the hope in that case would be that I have something that is manageable and will be static, and I'll do all the right things, and then I'll just kind of go along and things won't get worse. That's totally reasonable to think. In some cases, that wouldn't be realistic. So to be realistic, okay, well, maybe I do have a condition that is going to be chronic, and maybe it's going to have some ups and downs, and I can still hope for a way to manage this and to find all the different ways, but not just medical ways, but lifestyle ways to kind of manage this, and so that these things don't get too progressive. That's also realistic. But maybe over time, I do end up with something that has more of a declining course. And in that case, what my hope is that I can have a longer life and that I have treatments. And even if somebody has a really, a more serious diagnosis, like, say, metastatic cancer, that doesn't mean there's no hope. Just the hope is going to shift to that I have remissions, or that the treatments still allow me to have time with my family. And even on the last day of life, there is still something to hope for. I work in palliative care, so I've been at a lot of end-of-life scenarios, and people still hope for things. They hope that they die peacefully. They hope maybe their family is there, and that they have, an easeful death. So we do kind of make the assumption that we always have to be positive. And you see this a little bit more when you hear people talking about cancer. There's a lot of fighting, battle metaphors of, you're going to beat this, we have to struggle against this. And I understand that metaphor, but actually when you often talk to people who have something serious or cancer, it gives them actually pressure, because it feels they've got to be putting on this fighting brave front. And they may not always feel that way, and that if they decline, that they've kind of failed in some way. So what we would hope for is that that individual could be realistic, and that the people around them are realistic about what's happening to them, and be hopeful for them, but not so much cheerleading as, oh, it's going to be fine, you're going to beat this, when the patient themselves may know that is not the case, and that they maybe want to be expressing their emotions of fear or sadness or anger, but they're feeling like, oh no, I've got to put on this positive front all the time. So the next key is what they call zoom out. And that's being able to step back and see the big picture and where it is, where you are in that picture, as well as what to expect down the road. So often, when you first get a diagnosis, there's all the focus on that immediate symptom, which is, obviously reasonable. But if somebody's got something that is going to be more ongoing, it's very useful to kind of get a more bird's eye view of what to expect. Not with a sort of a doom and gloom, a negative future scenario, but I kind of want to know what's likely to be happening to me so that I can plan ahead a bit. So for the what ifs, I'm going to focus on what I can do now, but I'm also going to be interested in the what ifs. All the things that I'm saying apply to not just the patient, but whoever is supporting them, their family member or their caregiver, it also benefits from having these kind of view of things. So sometimes when you go to a physician or a nurse practitioner, and you're wanting to know what's ahead, you'll get these comments like, well, I don't know what's going to happen to you, or there's no kind of crystal ball. But in fact, almost every common illness has a well-known pattern. That's what they call the storyline. So you could map out, name a condition, and we could map out what in general is the storyline of that condition or disease. We don't know the timeline for you on there, but we know the general storyline. So that is very helpful for people to think ahead about what could be next. So first of all, is this a chronic or an acute? Is this something that's going to go on, or is it something that's short-lived and will end? If it is chronic, where am I in that trajectory? Is this early stage? Let's say I have COPD. Is this early stage? Is it middle? Is it later? Is it end stage? And there are markers that tell the physician where you are on that trajectory. Not necessarily where you will end up yourself, but in a general. So for example, somebody has absolutely nothing the matter with them, but they're just aging, and we call that the dwindles. You kind of dwindle away. You know, it's a very slow trajectory like this, and then sooner or later, the system fails. If somebody has a sudden death, they're going along like this, and they have a sudden massive heart attack, it's like that. COPD tends to have this fluctuating course, slightly downwards, and eventually somebody would likely end up with end-stage COPD and die eventually. Might be very, very long period of time. Alzheimer's has a downward slide like that, which is fairly quick. Other kinds of dementia, like Lewy body dementia or frontal temporal dementia, have a more undulating course, but it's downwards, right? So one of the things that we notice in our work is that somebody will have a condition and they end up, let's say, in hospital with pneumonia, and they recover from that pneumonia, but they don't come back to baseline. And there's often that expectation that, okay, you just get over that and things go back to normal. And sometimes they don't. I mean, sometimes they do. And it's important to know that because you need to know to prepare for what is next. So although that might just, those descriptions might seem a bit gloomy, in fact, the more realistic you are about that, the more you can plan for things and not be blindsided. I mean, there might be a feeling that I would prefer to, kind of not to know things because it's painful to hear. And it is painful. But then you have a chance to adjust. Whereas if we kind of pretend nothing's going on, we don't get a chance to adjust, and things are going to happen to us and trip us up or trip our family up, and people are not going to be prepared or be psychologically adjusted to the situation. So know your style. So what this is the style of what is your tendency, natural tendencies when facing life challenges. And the inner crew, those are the people that support you. So if you think about a graph with concentric circles, you're in the middle, and then your most close supporters, maybe your spouse or your immediate family or your best friend is in the next circle. And then your other friends and other supporters are out from that. Maybe if you're in a church group or something along that line. And then maybe the next circle is neighbors and people that are a little more distant from you. And somewhere in there are your healthcare providers of people that you've connected with through medical. So your inner crew are the people that are closest to you, and they basically need all the same information that you need. Right? And so this applies to those people as well as to yourself. So when you came in, we handed out this sheet, and I'm not going to center anybody out here, but the idea is having a sense of what your style is as well as the people who support you, because it might be very, very different, and you might want to meld those styles. So just to go through this a little bit, are you somebody who waits to be told and would really rather not face a situation and kind of hope it goes away, or you're somebody who wants all the information right away? And so in terms of having hard conversations? Are you somebody who doesn't want to really hear the negatives and you want to have a positive spin on everything? Or do you want the information delivered straight up to you? When you're planning in the future, are you somebody who likes to go along day by day, just go with the flow? Or are you somebody who's a super planner, who wants every detail and has, maybe charts and graphs to indicate what's going to be happening? Do you tend to be more passive? Maybe you're shy or just introverted, and maybe don't ask too many questions when you're at a healthcare providers, or you're somebody who's very assertive and you're not afraid to challenge something and get the things that you need. Are you somebody who has a hard time making decisions? Not necessarily that you can't make a decision, but you're carefully weighing all the pros and cons, and you want to go over lots of details. And you may be, I just sort of want to keep everybody happy here. Or you're somebody who's very decisive, and you take charge, and you make decisions very quickly. How do you cope? Are you somebody who has coping mechanisms where maybe things like you kind of isolate or hide away or drink or eat or those kind of things, which obviously can lead to other problems? Or you somebody who's developed a lot of healthy patterns of being open and talking and getting support, maybe yoga or prayer or exercise, that kind of thing. Some people are very private and they really do not want to have a lot of interactions with others, and they maybe don't want to share a lot of what's going on in their inner world. And other people who are very open and very comfortable sharing what's going on with them and putting things on Facebook, for example. And then the organizational style is some people have a hard time gathering information and being organized, and other people would have a system to handle everything. So, just a show of hands, how many people came out as more or less 3 or 4s? So a fair bit. And would anybody permit to being 1s and 2s? I assume the people who weren't 3s and 4s, but they're not admitting it. Now, the thing is, there's not really a wrong way to be. Obviously, there's the extremes of anything can be problematic. So, like for example, I'm very decisive, but sometimes I'll make a decision too quickly, just in order to have a decision made and not consider all the facts. So it isn't always good to have those particular qualities. And even though I would come out mostly 3 and 4s, in the level of assertiveness, I'm pretty assertive on behalf of other people, but not so much for myself, probably coming from a generation where you don't question authority. So I could be assertive with my own family doctor, but if I get sent to a specialist, I might hold back because, well, he's a very important doctor, and really he was a man. So it doesn't matter how assertive you are in some areas, you might not be in one. And obviously, if you're part of a couple or you've got a support person, their style might be very different. And I saw some people looking at their partners as we were going through this, is that they might be quite opposite. So and they know I'm going to tell this story. So my sister and brother-in-law, who are quite a bit older than I am, they have a lot of health conditions, my brother-in-law particularly. So he would go to the doctor, and my sister would say before he went, "Don't forget to ask about this, this, and this." And then he'd come back from the doctor, and she'd say, "What did the doctor say about this, this, and this?" And he would say, "Well, it didn't come up." And so I see a lot of recognition here. So in that case, if it doesn't really matter, okay, it doesn't really matter. But what if it's something important that you really need to know? And that individual, my brother-in-law, is not going to be different. So my sister has to go with him to important appointments because otherwise he doesn't get the information, and there's implications to that. So, I mean, it's sort of a joke between them now. It didn't come up as a sort of a family joke. But you can see where if you are one kind of a person, you may need to have somebody with you to help you get the information that you need. So we do have this idea that, if you go to the doctor and you get a diagnosis, okay, well, that's it. Now you got the diagnosis, and it will unfold as it will. But in fact, your style will greatly affect what the outcome is. So if you're somebody who holds back and doesn't get the right information or get to the right place or get follow-up when you need it, the outcome is not going to be as good as if you're somebody, or you have people who help you get the information you need to make the right decisions for you, because that's the important part, is for you. So the next key is customizing your order. Which sounds a little bossy, but it's important, is that because you need to advocate for yourself so that you're going to get treated as a whole person. What do we need to know about you as an individual to give you the best care possible? That's the ideal question that we need to be asking our patients, because you are uniquely you. I would think lots of older people, including myself, would think that, okay, well, the doctor knows what they're doing. And often we get a question of, what would you do, doctor? Or if this was your mother, what would you do? We really shouldn't be answering those questions, because how do I know what is going to be best for you? I can tell you this is generally what we would do in this circumstance, but we need to apply it to you because your situation is unique. If let's say there's a young person who's got cancer, their decisions, and they've got children, their decisions are going to be way different about what they do. They might be prepared to do a lot in order to have every day possible with their kids. But if they're 85 and they've got a bunch of other conditions, they might not want to be going back and forth to Barrie and having treatments that are difficult. They might just want to stay at home and be with their family and have good palliative care so that their symptoms are controlled. So maybe the same diagnosis, but very different situations and contexts. So I might know what this treatment for something is, but you are the expert for you, and you need to bring that to the table. Okay, so anticipating ripple effects. So who is going to be affected by this change in your health or your situation? It's going to be you, obviously, if you're the patient. But obviously, it's going to affect the people that are around you, whether it's the people you live with, like your spouse perhaps, or your family, or your friendship circle, or your work scenario if you're employed. Almost all healthcare is delivered outside of the system. So that means there's a whole bunch of people out there that are going to be drawn in to be supportive in one way or another. And anticipating what those things are is really important. And that there's a team. So you have your own individual team, and then there's the medical team, and they shouldn't be siloed. We should be trying to integrate that as much as possible. I know there's a lot of barriers, which we're going to be talking about, but it is possible to work towards that. So I don't know if you've had the experience. So you go to the doctor and you've got something going on. Let's say it's something more serious. All the focus is on the person with the condition, and and rightly so. But there's other people there that are going to be as affected, and that is the supporters or the caregivers. If we've got something going on, everybody in our life is on that journey with us in one way or another. And as the caregiver needs to be thinking about what it is that they need, and hopefully that the patient is also able to say, these are the things I need, but I'm acknowledging that you as my supporter, caregiver, can't be everything to me, all things to me forever. I'm just going to focus a bit on caregivers. This is an awesome organization, which lots of people don't know about. It's called the Ontario Caregivers Organization. And their website is terrific. If you know anybody who's a caregiver, or you are, I would encourage you to head them in this direction. There is a lot of great information in there about anything to do with a serious illness, and if you as a caregiver, and there's webinars, there's individual support, there's peer support, there's all sorts of things available. And they also know the resources in your area. So if you find yourself in some circumstance and you're not sure who can help you, they've got all that information, and they're very helpful. So one of the things that's in there that is very useful, I think, is, because I think it's something we all need to pay attention to, is advanced care planning. What do I want should I find myself in a serious situation? I have a stroke, for example. What kind of treatments am I going to want or not want? And how do I let people know around me what it is that I need? We do not have living wills or advanced directives in Ontario, but we do have the ability to have a guideline for those people who are close to us to tell them what it is that we might want or not want, what our values are. And in these packages, they help you come up with what it is that you value. Are you somebody that values lifespan or the quality of life? What are the things that are going to be the most important to you? They also would encourage you to have powers of attorney, and I would as well. Is just to refresh your memory, there's the powers of attorney for property, and that is if for somebody to manage your affairs if you couldn't. And just a caveat, as soon as that paper's signed, that becomes active, so you'd always want to really trust your power of attorney for property. The other power of attorney for health, it only is activated if you lose capacity and somebody is going to act on your behalf. And they are to act on what your wishes are, so they need to know what your wishes are. It's not what they think you should do, it is what you think that you should, what you would want. Connect the dots. Who is going to be liaison between you and your inner crew and supporters and the healthcare providers? Somebody who will connect the dots. I sure wish that the medical system was more connected, but it's just not. There's lots of efforts to have that happen, but it's pretty siloed. There's Cancer Care Ontario is doing a pretty good job, and there's other ones that are doing a better job, but it's pretty separated, particularly if you start to have different specialties of different body parts. So it would be good to have somebody who's paying attention to those things. So there is this assumption that the system will lead the coordination, but generally that is not going to happen. Somebody, you, if you're able to, or somebody in your circle needs to take charge of what's going on and keep a track of things. So in that caregiver organization, they have an excellent format which you can print off where you would put all the information that you might need to share with others. Like if you go to this specialist, I'm sure people have had this experience of getting there and they say, okay, well, how can I help you? Meanwhile, you've had all of this other kind of treatment and they don't seem to know any of that. So, and that's because either things get lost in the works or they just are not coordinated well enough. So if you have documents that list, okay, these are the treatments that I've had, these are my diagnoses, these are the medications that I'm currently taking. This is what happened to me last week when I went to the hospital, my most recent history, and they did these things to me. And these are kind of the things that I'm here for. That is very helpful if you've got some kind of document that you can give them that gives an overview. You don't have to go over every time you had the flu, but the things that were significant, relevant to your circumstances. And if you're in a situation where you're getting a lot of care at home, it's useful to have a binder where you keep all this information because people, there's people coming and going, nurses and OT and physio and doctors and various other professionals. It's very useful to have everything in a binder and that you would know who to call when this happens, who is the touch point, who's the case manager, for example. These are my doctor's numbers. This is who I call for after-hours care. So if somebody's in a maybe a more, their end of life or a more serious scenario. It's really important to have that information all together. The last key is invite yourself. And what you're inviting yourself for is to be able to initiate the conversations about what to expect, is to step forward and say, doctor or nurse practitioner, these are the things that I need to know to make the right decisions for me. One of the things that we used to, and this has certainly happened when I was in practice, in general practice, was we would say to people, if you don't hear anything, that's good news. Unless it was somebody who, we were sending off for a test for something worrisome, then even if it was fine, I would obviously call them because I knew they were worrying. But that isn't the case now. There's so much data and information coming into the doctor's office that I would not count on the fact that you are going to get a call if there's something going on. So if you are going to the doctor for something that's not just routine, that you're worried about, I think it's a good idea to make a follow-up appointment where the test results will be in and I'm going to come in and talk to the doctor about those results, even if they're normal. Or that you call back in and not just assume somebody will call you. There is this idea that, you have to be a good patient and not be asking for things and not be bothering the doctor. But in fact, it actually is not true that you're going to get better care. You just might, get forgotten, not through neglect, but just because of the immensity amount of work and patience and information that there is. And on our side of things, sometimes we are waiting for you to ask us the questions. We try to teach the medical students to not do that. Now, you're not just going to come in and just blast out a whole bunch of information, particularly if it's not good news to the patient. But we're going to invite them also to what it is that they want to know. What do you know already about what's going on? What are your fears? What is it that would be important for you to know right now? How much information do you want to have now? And then from the patient side to be able to say, well, I want it all, doc. I want to hear every single thing. Or they might say, well, I can only absorb so much, so just tell me what's important right now. Or they might say, I can't bear to hear any bad news, in which case we would have to find some other way to deliver that news. So obviously, all of the stuff that we're talking about requires you to somehow get this information, and that there are barriers, obviously, to getting this information. So, and I'd be interested in what barriers have you encountered, if you care to share that. I mean, I heard a story where somebody wanted to make a change in their medication, and they called the doctor and, okay, well, an appointment is offered, but the appointment's way down the road, and that's going to be too late. And then, okay, well, you can call in the morning, and maybe you'll get an appointment. But then all those appointments were taken. So there's a situation where somebody needed an answer, and they were not going to have access to the person who has the answer to that question. So that's a barrier, right? And so there's ways to begin to try and overcome those barriers. So what kind of barriers have people had when you're trying to get information? Now, somebody said it's been totally smooth, which I'm very happy to hear about. Yes.
So one of the biggest problems for us, if we go to have a test, we have to go to the annex because we're one of the lucky that don't have no doctor. And so they order a test, you get the test done, but then you try and get any follow-up information. The person that ordered the test originally is no longer at the annex. And
So,
then to get back in, it takes time.
Yeah, so that situation is a common situation. If she's saying that she does have a family doctor and that she has to go to the annex and they have different doctors there, so how do you get those results? I'm just going to move ahead here because I'm getting notice that we're kind of running out of time. So these are some of the barriers. And there's ways around these barriers. I don't want to bother the doctor. So in your case, don't worry about bothering. You call every day and get those results. We might not know the questions to ask, but what we need to do is make sure that the doctor knows this is what I need to know. What should I know, doctor, in order to prepare for the future? What is the course of this illness? What if you're not an assertive person? Then bring somebody with you who will help navigate. I feel so overwhelmed by all the information. I'm getting way too much information. Take somebody with you to take notes. You can record the sessions. You can get your reports, which is not always easy to get, and you can get information in little bites. I'm not sure that the doctor and I are on the same wavelength. You need to be clear what the wavelength is that you are on. If you see a specialist and you do not fit together, you can ask for another opinion. I know it's difficult, you have to wait forever, but that would be important if you've got something significant to have the right doctor. We can't be changing primary care doctors because there's not enough of them. So being assertive is the key here. Ideally, you have a doctor, you say, explain my results, and they'd say, I'm happy to explain. Or, this might work too. Okay, so we're going to just put all this together. Set your goal to be in the know and not be in the dark. Stay hopeful while being realistic by walking two roads. Learn the big picture by zooming out. Work with your style and that of your inner crew. Collaborate with your medical team on the approach that works for you. Anticipate the ripple effects around you and make plans. Connect the dots between your situation and those around you, and invite yourself to speak up, ask your questions, and get the answers that you need. So we may have run out of time here, but if there are questions or people have comments they want to come, they can come and speak to me after. I'm good? Yeah. If there's anybody interested in doing any of this in a more thorough way, you can sign up and I will give you a call and let you know when the workshops are coming up. We have one specifically for cancer patients or their supporters coming up in May. It's being organized through Enliven, which is an awesome organization for people living with cancer. And we are going to be running another one in June that we have some spaces for. And we'll run them as long as people are interested. So any questions? Yes?
How would you navigate if you are one style and your primary person, your spouse or your children are on the other side of that spectrum where, it could end up being a bit of a clash?
Yeah.
And, they don't want to know, like, you need to know. How do you navigate that?
Yeah, that's a common and difficult situation that we come across where the styles are very different. So if it's you that wants to know things and the other people don't, look for other people in your life that do. And you might have to give the people who don't want to know things little bits of information that in little bites that they can tolerate. And that you can say to them, listen, I really would value your support. And for you to be supportive, you kind of need to know what's going on. What are the kinds of things that you're prepared to hear? If the patient doesn't want to know what's going on and the people around them do know what's going on, and so there are some cultures where they do not want the patient to know what's happening, that is more challenging because they're the person who's supposed to have something. And it's quite a challenging thing, again, if somebody doesn't want to know anything and they're the patient and they should be having treatment or some kind of involvement, is we can't control what other people do with their lives unless they've lost capacity. So again, it would just be patiently and slowly encouraging them little by little to access the care in a way that they can. And maybe involve other people like their healthcare people to help, or social work, for example, or therapists even. Yeah. Yes?
I find a difficult question is, who do you tell about a serious diagnosis? And who do you not tell? A, you don't want to overburden someone who you feel close to, but you don't want to lay your problem on their shoulders. Then the other question is, you're in a group or so on, who do you share? You really need to be able to share in some way, but who do you share without creating distance between you and the other person? I think there's still something out there that people are afraid some diseases are transmissible.
Yeah.
And they really aren't, but that's in people's mindset. So you don't want to alienate yourself from others, yet you have a need to share your concerns.
Yeah. So the question is, how much do you share and where do you share, right? I think you have to keep looking for people. Sometimes it might just have to be a professional of some kind, or amongst your friends. I understand what you mean about overburdening the people that are your supporters if you've got lots of bad news. And I would be checking in then with them, is this too much for you? Or as well as saying, let's just go for a walk and talk about other things today, so that it isn't always about the kind of negative things. But you do need to have someone to share with, and if you live on your own, that's going to be difficult. But if there will be people who want to hear, and maybe it is things organizations like Enliven, pretty well every disease has some kind of organization, and that they have supporters, and they have peer support, and they have volunteers. So sometimes it would be something in that. But I mean, I think it's true. It is important that you don't carry all this by yourself. Yeah. Anything else? Thanks very much, everybody, for coming. It's always not the most cheerful of topics, but it's important information, and we do better if we are in the know. Yeah. Okay.